Hello everyone, my name is Dr. Ferox and I am a veterinarian who works full-time who happens to have been diagnosed with multiple sclerosis a couple of years ago. Now, if you like, I can talk about how I got diagnosed, what it presented as, and all of that process, but I will do that in a separate video. In this video, I wanted to talk about how I accommodate my MS in order to still work in a reasonably demanding job. In addition to working full-time as a vet, I'm also a single mum with sole custody. So I always have something to do. I am never bored. In retrospect, it's probably fair but weird to say that I was diagnosed with MS fairly early because MS can do lots and lots of different things. It is a disorder of the myelin sheath around all your nerves, so it can affect just about anything, and the signals don't transmit properly up and down the nerves. Specifically for me, my symptoms can be grouped into hand problems, so I'm lacking a lot of sensation and dexterity in my hands, which as a surgeon was a bit of a bummer, and fatigue. Like, the fatigue's quite awful, and any symptom gets a lot worse when I am very, very cold or when I am very, very hot. And today was about 30 degrees Celsius. I am in Australia. I am in the colder part of Australia. So 30 degrees Celsius, I think, is about 86 degrees Fahrenheit. And that is hot enough for me to start having trouble. And in addition to all of that, the medication I take to slow down my MS and control those symptoms also has a set of problems on its own. So I'll go into a bit more detail. So in regards to my hands, I usually experience numbness, and if I push my limit too much, I will start to experience pain. This was particularly bad trying to perform surgery. So in sterile surgery, first of all, you wear a gown, which has a sleeve that comes up to your wrist and constricts. And you also have a surgical glove, which comes down to your wrist and constricts. So you have this double constriction at the wrist. And that combination makes you already quite hot. And then you are leaning over and operating on a patient who has a body temperature of around 38 degrees, because I'm a vet, not a human doctor. And often that patient is being actively warmed by a bear hugger. So that is hot air like a hairdryer blowing in and around the patient. So I would overheat quite easily. Now that would start with numbness coming through fingertips on both sides, because I'm lucky like that. And that numbness would progress. And then it turns into pins and needles, which turn into progressively sharper daggers and start traveling not just my hands, but all the way up to my shoulder. And no amount of occupational therapy or physiotherapy has actually got me to recover that. Initially, when I didn't know it was MS and I thought it was carpal tunnel, I would then try and ice my wrists after surgery, which starts to feel better until I get too cold, and then I get all the same symptoms happening at the other end of the temperature spectrum. So I don't currently do surgery anymore, which is a bit of a bummer, but I guess not everybody does surgery, so I can live with that. I can scrub in for small surgeries. If a new graduate drops a spay pedicle or something, I can scrub in, help them out, and then get them through the danger period and let them finish. Or if it's a stitch up and you don't have another option, I can jump in, but I tend not to do a huge amount of surgery because I'm not feeling as good about it as I should. I can't tell if the tissue has a pulse under my fingers. I can't tell if it's warm or devitalized properly. And I think if a pet owner has an option between a vet who's not super confident she's doing a good job and a vet who is, you're paying the same money. Use the vet who's actually confident they're doing a good job there. So I in addition to the sensation, there was also a lack of strength. So pulling things up or pushing in, if I'm trying to do a dental, I was physically weaker. A lot of twisting motions. I was not capable of tearing tissue like I should have been. The clamping motions, I lacked strength, which was most obvious doing a nail trim on a dog because I could not close the nail trimmers hard enough to go through the dog nail. There's a lot of different physio things I've had to do. So between physio and occupational therapy, there's lots of different exercises I've been trying to do to get strength back, whether that's rotational or strength pulling away. And it has helped. A lot of these exercises do help, but they did not get all of the sensation back. My strength is a lot better, but still not quite good enough for surgery. I can now turn the key in the lock and I can open jars of jam pretty consistently, but it's still not quite up to scratch for surgery. Even little dexterity exercises like stacking coins. Like I used to do it a lot on lunch breaks because that's the easiest time to remember to stack things or to do the exercises. And having a workplace that lets you consistently get a lunch break so that you can actually rest and do your exercises is really super helpful. I think at the peak I had about an hour and a half worth of physio and occupational therapy exercises to do each day. I don't do that much anymore, but it's hard because it's tiring, and my other big symptom is being tired, but it is worth pushing through it. So because of the hand sensation issues, I'm not primary on any surgery. I really do bugger all surgery. I mostly do consulting. If I'm having a bad day, I will try and get the nurses to do the nail trims, particularly for bigger animals. And often reception will preferentially book larger dogs with other vets because they know I'm not as nimble on my feet, especially if it is a boisterous or aggressive dog. I don't dodge as quickly as I used to. So I tend to see a lot more cats because they're all at table height, and even if it's an aggro cat, it's easier for me to physically manage. Sometimes I've had to get a second person to confirm the absence of a pulse. If I can find it, I know it's there. If I can't find it, I don't always believe it's not there. And while I'm mostly pretty good at still placing IVs and getting blood draws, if I know I'm having a bad day with the hands, I just tap out. I'm not going to force my way through it. I'm lucky that I have a bunch of nurses that are all extremely capable, and other vets working in the practice that I can go to for, a 20-second assistance here and there. And it's less than it used to be. So doing all the occupational therapy and physiotherapy helps. It just doesn't feel like it at the start. So the other big symptom I get with MS is fatigue. And it's not just my arms, but all through my core and particularly my legs. If I'm consulting all day, which is what I do now, it's not great for me to be standing up continuously for hours and hours and hours. So I have a seat in my consult room so that I will try and stand up while talking to the client and handling the pet, and then sit down when I'm writing up the histories. So I might be standing for 10 to 15 minutes, which is long enough for me, and then sitting for 5. In between appointments, I will usually have a couple of appointments and then a phone call break scheduled, which is where I call patients about blood results or fill prescription repeats or otherwise do paperwork where I'm not client facing in the room, so I can sit down and work for that 20-minute, 30-minute block. We also schedule our days so that we have pre-planned appointments and then on-the-day bookings, which we implemented through the pandemic lockdowns because we were absolutely swamped. We were insanely busy. So we would book out days ahead, which is no good when you have an acutely sick animal. So we ended up keeping a few slots on the day to only book that day for things that really needed to be seen in the next couple of hours or at latest the next day, so that they didn't get forced to go to an emergency centre. We've still kept them, and on most days they probably get about half filled, and if I'm not seeing a patient, they turn into another sitting task for me to do, because there's always something. Also, the last 20 minutes of the day is always allocated as a sitting task so that I have a chance to catch up on everything so that I leave on time. Because if I don't consistently leave on time, I end up burning out. You've probably heard of spoon theory, and it does apply where you've only got so many big spoons and then a few little spoons, and once you've used up all your spoons, you're out. There's also knife theory, which is when you've run out of spoons, you can get a task done by using a knife, but it is going to hurt you later. I work best at about 80% capacity most of the time because I can do that every day. If I push myself to 100 or 110% capacity, I can still do it for one day, and then I will need to spend the next 3 days recovering. So it's not sustainable. Now, I preferentially see small and feline patients. This is Pancake, because I can have them on the table, so it's physically easier for me. I will sometimes, when doing their exam, lean forward on them to squish them down on the table, because it's easier to handle them that way, and it is also good for my back. And most cats don't mind this sort of pseudo cuddle while they're being handled. I will see large dogs. Greyhounds are great, but if they're large and bouncy and they're going to knock me over, I'll see them, but they're not my favourite thing to see. Thank you, Pancake. Good boy. I will also sometimes consult leaning forward on the table because I'm tired, I'm fatigued, but I still have a job to do. It does not look as professional, but I haven't actually had any complaints. And if somebody does complain, I will explain that I am leaning on the table to talk to them because I have a disability and I can either do this or not work at all. Sometimes I will go the other way, particularly if it's a big dog walking around on the floor and I'm watching it, and I will lean back on the wall or back on the bench just because I'm fatiguing. And nobody's brought it up so far. There are chairs that the client can sit on while I'm leaning on it, so it becomes quite a casual sort of consult, but that's okay. It still works. And as I mentioned, both being too hot or too cold makes everything worse. And as a fun fact, if I get too hot or too cold, the nerves that tell me I am hot or cold stop working, which is something of a design flaw. But working in a clinic, I will often have nurses go, "Gee, it's hot in here," or "Aren't you cold?" And that might remind me that, yes, I probably am cold, logically, and I should do something about that. It is a lot harder to manage the heat because it's harder for me to cool down. But the clinic has decent aircon, and I will sometimes just stand under the ducts if I'm not processing super well. We have icy poles in the freezer, so I can eat something frozen. But it's not ridiculously bad as long as I'm inside. I will avoid a house call or seeing a patient in the backyard if it's really hot because it's just going to cook me. The cold is easier to manage. My lovely nurses will put a little bar heater under the table in my consult room first thing in the morning. So my room is preheated, which is nice. And wearing things like thermals or fingerless gloves makes it easier to stay warm. You just have to be careful not to let a dog pee on the heater because they will, and it smells really bad. But you live and learn. The other useful accommodation I get at work is related to the medication I take, which is Kesimpta. Kesimpta is an injection I administer myself every 30 days, which means the day of the week that I take it is different all the time. And I try to organise a rostered day off when it's due because it makes me very strange. But if I can't, I can still take that as a sick day, and I don't have to get a doctor's certificate because it's just one day. When I started Kesimpta, I had fevers and vomiting, and it looked like gastro and muscle tremors, and I was all sorts of sick. I probably shouldn't have been left alone. But now I've taken lots of doses. I get this sort of vague headache, poor decision making, not quite right to drive, can't climb a ladder, and if I can't drive, then I can't be performing medicine, so I take those days off. I'm hoping to switch to Ocrevus next year because that should be 2 days a year instead of 12 days a year, but we will see how that goes. And fun fact, because I'm in Australia, Kesimpta is on the Pharmaceutical Benefits Scheme. So without that scheme, the full price of my medication would have been about $2,200 per month. Because of the Pharmaceutical Benefits Scheme and tax dollars going into what is essentially socialised medicine, it costs me about $30 delivered, which is good for me. I guess the other thing worth mentioning is that I get occasional migraines, but I don't know if that's MS or just because I am a female who's over 30. So the things that helped me maintain a functional capacity the most was doing the physiotherapy combined with the occupational therapy, and we threw a bunch of hydrotherapy in there as well, because I actually had a fall. I don't know when I became old enough to be considered to have a fall instead of fell down, but I have reached that point now. So part of that hydrotherapy was geared towards maintaining my balance so that I don't have a fall again, embarrassing as that is. It was a lot of hard work. So between physio and occupational therapy, at one point I had an hour and a half worth of exercises I was supposed to do every day, which was quite a lot. It was really tiring, especially when you have a condition that makes you get tired really easily. So that was a slog, but I'm glad I did it because I'm more functional now than I was 12 months ago. I do apologise for the cat making very sloppy, kind of disgusting noises. It's not his fault. It's a condition. That's why he's my cat and nobody else's. I could not adopt the Cluthu sounding beast to anybody else. But he does sound quite disgusting when he's next to your ear. You're lucky you're cute. Getting my nutrition under control was also helpful because if I've meal prepped and frozen things, it costs me more energy on day one, but it will save me energy through the subsequent weeks. And lowering the stress in my life in general has been hugely helpful because if I stress out about things like family law courts, my symptoms get a lot worse. So I'm very glad that I don't have to deal with that at the moment. I still wear a mask at work, so a face mask, to reduce the risk of me catching infectious respiratory diseases because my medication functions like an immunosuppressant. And I will still field questions from that occasionally from people who are either embarrassed that they forgot a mask in a small enclosed space, or are confused that people would still be worried about that because some of us take immunosuppressants and cannot afford to get sick. But in general, I have a much better handle on things now, 3 years down the track, than when I was first diagnosed. Partly that's all the physical therapy, and partly that's figuring out where my limits actually are. Because if I stay just within my limits, I can do that every day. If I push myself beyond my limits, it's going to take me 3 or 4 days to recover, and that's just not sustainable, and that's just not worth it. So I do unfortunately do less than I used to, and I've basically said goodbye to surgery. But it's not bad overall. Like, it's manageable like this, and hopefully I can continue at this level for quite a while. You just have to find the things that you need to manage. I hope that was helpful. If you've got any questions, feel free to drop them into the comments below. And hopefully I can get back to some more veterinary focused videos once I've figured out how to make this technology work a little bit easier. So thank you, and enjoy the rest of your day.